As a healthcare provider, your mission is crystal clear, right? It's all about delivering the absolute best patient care. But what if I told you that there are these hidden forces, things you might not even see, that are quietly draining the financial lifeblood right out of your practice? Let's uncover them.
And really, that's the big question, isn't it? Your focus is, and should be, on your patients. But the financial health of your practice, well, that's the engine that keeps the whole thing running. And if you ignore it, you could be heading for some serious financial stress.
Okay, take a look at this number. It's pretty staggering. Research from top sources like the Healthcare Financial Management Association shows that overhead can eat up as much as 75% of a practice's revenue. And you know what a huge piece of that is? The massive complexity and cost of just trying to manage your own billing.
So let's actually break down what that hidden drain really is, because the real cost of doing your billing in-house isn't just about salaries. Oh no, it's the time, it's the resources, and it's the focus that gets pulled away from your actual mission. It's a constant uphill battle.
I mean, think about it for a second. Keeping up with all the different payer rules, the endless coding updates, and all the compliance regulations, that's not just a task, it's a highly specialized full-time job. So when your team is stretched thin trying to juggle all of that, you're not just losing time, you're losing energy that should be going to your patients.
And this isn't just some minor inconvenience. It is a direct threat to your revenue. Even tiny administrative mistakes, whether it's in the billing or something like provider credentialing, they can have absolutely devastating consequences for your bottom line.
It's like a chain reaction, a domino effect. One simple little coding error can trigger this whole cascade of problems. You get a denied claim, which leads to delayed payments, which totally disrupts your cash flow. And before you know it, your staff is spending all their time chasing down payments instead of actually helping patients. It's a vicious cycle.
So how do you break the cycle? Well, the solution isn't about working harder. It's about working smarter. And that means we need to start thinking about outsourcing, not as just another expense, but as a really powerful strategic investment in the future of your practice.
At its core, outsourcing is really all about partnership. You're not just hiring some vendor off the street. You are bringing in a dedicated team of specialists whose entire job is to navigate the complexities of the revenue cycle for you, making sure every single claim is handled with precision.
And what this partnership really does is it fundamentally changes your focus. It just lifts that immense administrative weight right off your shoulders. It frees you, and it frees your team to concentrate on the real reason you all got into medicine in the first place.
And that's it. That's the heart of it all. This is about getting your practice perfectly aligned with its primary mission. When all the billing headaches are being handled by experts, all of your time, your energy, and your resources can be poured back into what truly matters.
All right, let's talk numbers, because this is where it gets really exciting. A strategic partnership isn't just about lowering your stress levels, it's about getting real, measurable financial results. It's about transforming your billing from a costly headache into a powerful engine for revenue.
First up, the cost savings. When you get rid of the overhead of an in-house billing team, we're talking salaries, benefits, training, expensive software, practices can slash their operational costs by as much as 30 to 40%. That is a significant, immediate impact. And hey, it's not just about saving money. It's about collecting more of the money you've already earned. The Medical Group Management Association, or MGMA, reports that practices who use expert billing services actually increase their collection rates by 15 to 20%. That's real revenue that otherwise just gets lost.
This chart just makes the financial argument crystal clear. I mean, look at it. When you add up the total cost of an in-house billing coordinator, that's salary, benefits, the works, the cost of a specialized outsourced partner is often less than half of that. And that's before you even factor in the extra money they collect for you. The return on investment is just undeniable.
Now, this is really important. It's crucial to understand that not all outsourcing companies are the same, not even close. The key is to find a true strategic partner, not just a cheap vendor. So let's talk about what that difference really means for you.
You see, a real partner manages the entire revenue cycle, from start to finish. It begins before the patient even walks through the door, with things like credentialing and verifying insurance. Then it moves to expert coding and submitting clean claims. But it doesn't stop there. They proactively fight denials, they follow up on aging accounts, and they give you clear data so you always know exactly what's going on with your finances.
So, how do you know if they're any good? You hold them accountable to key industry benchmarks. Take a look at the clean claim rate. A good partner should be hitting over 95%.
That means fewer mistakes and way faster payments. And, just as important, their denial rate needs to be under 10%. These are the numbers that separate the pros from the amateurs. And this brings us to the final, critical choice you have to make. Look, a low-cost vendor might seem tempting with a super low percentage rate, but their focus is just on pushing claims through, not on quality. That often leads to sloppy work and a ton of denials. A strategic partner, on the other hand, is focused on performance. They invest in the experts in the tech to maximize your revenue. It is the classic definition of penny wise, pound foolish.
So I'll leave you with this one question to think about. Right now, is your billing process a liability or is it an asset? Is it a constant drain on your practice or is it a streamlined engine that's helping you grow? Because choosing the right partner doesn't just change your billing, it can change the entire future of your practice.